Hello, welcome to Chapter 13, the urinary system. So we're going to go through the major terms for the urinary system. We're going to look at their prefixes, their suffixes, abbreviations, spelling, pronunciation, and the different structures of the different organs. So let's get started here with the urinary system. So here is an image of the urinary system. It consists of two kidneys. Your kidney's role is to filter the blood and get rid of waste products from the blood. There's two ureters. These ureters transport urine from the kidneys down to the bladder. We have one urinary bladder, which holds urine before excretion from the body. And then we have one urethra, which is used to transport urine outside of the body. So let's look at some of these different terms here. Let's find the suffix. OUS means pertaining to. Nitrogenous means containing or generating nitrogen. Al means pertaining to. Renal, pertaining to the kidney. Airy, urinary, pertaining to urine. Ical, urological, pertaining to urology. All of these suffixes mean pertaining to. There's a lot of different suffixes that'll have the same types of meaning. So let's find the root of each of these words. Nephrectomy. Nepher, the root that means kidney. Rene means kidney and renal. In urination, urine means urine. Urology. Here's our combining form. Uro, which means the urinary system. Some words in medical terminology come straight from Latin or Greek, like nephron. Nephron is Greek for kidney. Urea is Greek for urine. Urine is Latin for urine. Ureter is Greek for urinary canal, and filter is Latin for strain through material. So nephrologist, nephro, that combining form, it means kidney. So that nephrologist is somebody who specializes in diseases and disorders of the kidney. Urologist. By combining form, uro means urinary system. So a urologist is someone who specializes in diseases and disorders of the urinary system. So some of these disorders: renal cell carcinoma. This is the most common form of renal or kidney cancer. Treatment for renal cell carcinoma is a nephrectomy. Wilms tumor can occur in childhood. It's also called nephroblastoma. A Wilms tumor is treated with surgery and chemotherapy. And then we have renal adenomas, or benign kidney tumors. Benign means they're not going to spread anywhere else. They're usually asymptomatic and they're not life-threatening. Acute glomerulonephritis is inflammation of the glomeralis that often develops after a strep infection. It does have a 100% recovery rate because it's acute. Those strep infections of the throat, we mentioned that strep that causes rheumatic fever, it can go down to the kidneys and cause acute glomerulonephritis. Chronic glomerulonephritis, on the other hand, can occur with no history of kidney disease or diabetes and can actually lead to renal failure, where your kidneys can no longer filter that blood. Nephrotic syndrome. This involves large amounts of blood proteins being excreted in the urine. It's treated with reduced sodium intake, diuretics, lose more water, and steroids. Interstitial nephritis is an acute temporary inflammation of the spaces between the renal tubules. It's often caused by allergies or is a side effect of medication. Pyelonephritis is an infection of the renal pelvis, which sometimes occurs as part of a UTI, a urinary tract infection. Polycystic kidney disease, or PKD, as it's also known as, is an inherited disease with large fluid-filled cysts that cause the kidneys to become ineffective. There's so many cysts in there, these fluid-filled sacs, that the kidneys can no longer do their job. Acute renal failure. It's a sudden cessation, stopping of that filtration process, which can be caused by medicines, toxins, burns, trauma, a systemic infection, and some blood disorders even. A chronic renal failure or chronic kidney disease, it's a gradual loss. It happens over time. Hypertension, diabetes, kidney disease. Chronic, most of the time when something is chronic, it has taken years to get to that point. Uremia is a complex of symptoms resulting from excess nitrogenous waste products in the blood, as seen in renal failure. Then end-stage renal disease. Those kidneys are functioning at less than 10%. Whoops, I wanted a pen. Less than 10% of capacity. Dialysis and/or kidney transplant is needed. Dialysis is a machine that filters blood and gets rid of waste products like our kidneys do, but it's a machine that does it instead. So let's deconstruct these words. Di is a prefix that means complete. Ur is a root for urine, and esis is that suffix that means condition. So diuresis is the production of a large volume of urine. Hematuria. Hemat means blood. Urea means urine. It's a suffix for urine. So hematuria means blood in the urine. Nephroblastoma. Nephro is that combining form for kidney. Blast going to mean an immature cell. Oma is a suffix for tumor or mass. So nephroblastoma would be a cancerous kidney tumor, which is usually found in childhood, this nephroblastoma. Pyelogram. Pylo is my combining form. That means renal pelvis. And gram is that suffix that means record or recording. So a pyelogram is an X-ray image of that renal pelvis and ureters, and it usually involves some sort of dye put into the blood that helps to light up those specific areas of that renal system. Dialysis and hemodialysis. Dia is a prefix that means complete. Lysis means to separate. So dialysis is an artificial method of filtration through a semi-permeable membrane to remove excess waste materials and water from the body. That hemodialysis, hemo or heme, combining form with the O means blood. So hemodialysis is an artificial method of filtration that removes excess waste materials and water directly from the blood. So there's a slight difference between the two. Nephritis and pyelonephritis. Nephr means kidney. Itis is inflammation. That second part of the word here. So nephritis is the inflammation of the kidney. It can be an allergic reaction to a widespread or wide range of drugs. Pyelonephritis, my combining form, pyelo, means renal pelvis. So pyelonephritis is the inflammation of the kidney and that renal pelvis, which often commences in the urinary bladder. Anuria or anuria, an is that prefix for lack of. Urine, IA is a condition, and urea means an absence of urine production. Oliguria, there's no prefix. We have the root or combining form, or just the root word, sorry, and that means scanty. So oliguria means scanty production of urine. We have other words. Hematuria. Heme means blood in the urine. Nocturia. Nocturia. I should add the T in there correctly. Excessive urine production at night. Dysuria. Difficulty or pain with urination. So let's go through some different abbreviations. ARF, acute renal failure. CRF, chronic renal failure. CKD, chronic kidney disease. ESRD, end stage renal disease. IPV, intravenous pyelogram. This is that use of dyes put in through the veins to help take x-rays that light up the kidneys, the ureters, the bladder, to help kind of light up that whole urinary system. A lot of these dyes, you need to know what dyes are being used, especially if you have shellfish allergies. Some of these dyes contain products from shellfish, which can cause severe allergic reactions in people who have those. PKD, polycystic kidney disease. And then UTI is that urinary tract infection. So let's keep working our way down. The ureters connect the kidney with the bladder. Kidney down to the bladder. Kidney stones usually begin as a grain. A lot of times they're calcium. As more minerals, more of these minerals accumulate, a calculus or stone is formed. The stones, renal calculi, can occlude the ureter. They can close it off, block it completely. Nephrolisthesis when these small stones can pass to the outside of the ureter or bladder upon urination. A lot of these kidney stones are usually made of calcium, so they can actually see them on x-ray without having to light up, do an intravenous pyelogram. They'll actually show up. Too much calcium in the diet can be one of the reasons why we get kidney stones can be formed. They're supposedly extremely painful, and it's the kind of pain that you keep moving. You can't sit still because it's so painful. Different ways to treat a kidney stone besides just letting it pass. Sometimes they're too large. So they need to be broken down. And this is where they use extra corporeal shock wave therapy. They use shock waves to break down this renal calculus into smaller pieces so it's easier to pass. That's the most common type of treatment now for kidney stones. So let's look at extracorporeal. Extra, outside. Corpore, that combining form, that means body. And all means pertaining to. Lithotripter. Litho is that combining form. It means stone. Tripter, pressure. So this is that instrument that creates those sound waves that crush those kidney stones into smaller pieces to pass easier. And then hydronephrosis, hydro, that combining form for water. Nepher, kidney. Osis, abnormal condition. So dilation of the pelvis and calyces of a kidney. It's an abnormal condition. So some of these words have double roots. Hydro, water, nephro, kidney. Hyphronephrotic, pertaining to, so pertaining to or suffering from the dilation of the pelvis and calyces of the kidney. Nephrolisthesis, nephro, kidney, lith, stone, iasis, condition of, so the presence of kidney stones. Abbreviations. ESWL. Corporeal, extracorporeal, shock, wave, lithotripsy. So that using those shock waves, those sound waves to crush up that kidney stone. IV, intravenous. So this is one of the ways that they administer medications. KUB, kidney, ureter, bladder. This is X-ray that shows the kidneys, the ureters, and the bladder all in one view. So let's look at that bladder and the urethra. So our urinary bladder, it's a hollow organ that has that smooth muscle around the organ and that floor, that pelvic floor. It's behind the pubic symphysis. We have different sphincters in there. At the top of the urethra, which is a thin-walled tube that takes the urine from that floor of that bladder to the outside of the body, we have an internal urethral sphincter. This one is involuntary. This is helping to hold urine in the bladder. This one we cannot control. So as that bladder starts to fill and stretch, that internal urethral sphincter will start to relax. We have an external urethral sphincter. This one is voluntary. This one we can keep the urine in the bladder till you get to a place where you can void, or that micturition, urinate, all mean the same thing. Both males and females, the opening to the urethra to the outside of the body is called the external urinary meatus. Males have a longer urethra than a female. Enuresis, bedwetting. So people who don't wake up when they need to urinate, so they wet the bed. And as I mentioned, that micturition, urination, and voiding all mean the expulsion of urine out of the body via that urethra. So we had mentioned urinary tract infection. What it actually is when bacteria, usually E. coli, will invade the urinary tract through the urethra. Urinary tract infections are more common in females because, as I just said, their urethra is very short. They will use what is called a urinalysis, where urine is collected and there's different tests that they will do on that urine to determine if there is an infection in that urinary tract. Urinary incontinence is where someone loses control of that bladder. They're not able to hold their urine in. It happens in women as they get older, unfortunately. After having children, it's another one that causes that urinary incontinence, where coughing, sneezing, laughing can cause release of that urine. That's stress incontinence. Urinary retention is the abnormal, involuntary holding of urine in the bladder. What can cause it? Well, it could be from an obstruction in that bladder or urethra that's preventing something to get out. It could be neurological, where the nerves that are supposed to let you know that you need to go urinate are not functioning. They're not working. So if those nerves are not there to tell you to go urinate, it's going to cause this urinary retention. Bladder cancer is more common in males than females. Cigarette smoking causes more than 50% of bladder cancer cases. Incontinence is that inability to prevent the expulsion of urine. So you can't hold urine in your bladder. Retention is holding back urine involuntarily. I mentioned some reasons why. Cystitis is the inflammation of the urinary bladder. That itis, again, is that inflammation. Cyst is telling us where? Bladder. Pylitis, there we go. Pylitis is inflammation of the renal pelvis, while urethritis is inflammation of the urethra. That urinalysis that I mentioned. The most common type of urinalysis is known as a dipstick test, where they take a little test that has a little stick that has a little bunch of test sections on it, and you dip it in that urine. What it's going to give you is it'll give you the pH of that urine, how acidic, basic, neutral, the specific gravity, proteins, blood, glucose, ketones, bilirubin, nitrates, and leukocyte esterase. These are all the different things that we can detect on just a dipstick of a urine test. KUB, that kidney ureters bladder x-ray. IVP, that intravenous pyelogram. It's using dyes, specifically iodine, which is why I mentioned shellfish allergies, because a lot of iodines come from shellfish, to light up these specific organs. A retrograde pyelogram, again, is using a contrast, but it is injected through a urinary catheter. So a catheter is a tube that is sent up into the bladder to help drain out urine in somebody who has retention. And it can be sent all the way up into the ureters and into the kidneys to locate the location of a kidney stone or any other types of obstructions that may occur. A VCUG. This is a voiding cystogram, where contrast materials are injected into that urinary bladder, again through a catheter, and then x-rays are taken as the patient voids, hence the voiding in there. So we can also do CT scans to obtain x-ray images and those cross-sectional views of the kidneys and the bladder to get a better idea of what's happening. MRIs uses magnetic fields to generate those cross-sectional images, the same as the CT idea. Ultrasound. Ultrasound uses sound waves. We can look at kidneys. You can also use ultrasounds to look at the bladder to see how full the bladder really is. See if somebody needs that catheter to drain it because they have that retention issue. Renal angiogram. X-rays and contrast materials are used to assess blood flow to the kidneys. And then a cystoscopy. We're using this instrument that is inserted into the urethra, or through the urethra into the bladder, I should say, to examine the bladder's lining and to possibly take a biopsy if needed, where they take some of the tissues. Some of the different procedures: watchful waiting, pain medications to help relieve symptoms. We do this with kidney stones because we can hope that that stone can be passed on its own. If it cannot be passed on its own, that extracorporeal shock wave lithotripsy, using those shock waves to help break apart that stone into smaller pieces so it can be passed easier. Ureteroscopy. A small little ureteroscope is passed through the urethra and the bladder into a ureter. Devices can be passed through that endoscope to remove the fragments of the stone. Percutaneous nephrolithotomy. A nephroscope is inserted through the skin and into the kidney to locate and remove a stone. Then there's open surgery. The incision is made to expose the ureter and remove the stone. But this is rarely done. It's not very common anymore because we have all kinds of other ways to get rid of kidney stones shockwave therapy, without having to even stick something inside of somebody. Okay, therapeutic procedures for kidney failure include dialysis and a kidney transplant. That dialysis, that artificial method of removing waste products or waste materials and excess fluid from the blood during end-stage renal disease. Well, that kidney transplant takes a better quality of life than dialysis, because dialysis can take a few hours and it's done a few times a week. You just need to find a suitable donor where different cell markers match. Other therapeutic procedures for treating disorders of the urinary bladder include that cystoscopy, where they remove a stone and perform a transurethral resection of the prostate in the male to remove tissue from the inner portion of the prostate gland and for benign prostate hyperplasia, BPH. And then bladder training. This is a biofeedback which helps to lengthen the time between urges to go to the toilet. They do this with little children when they're potty training. They do this with stroke patients. They can do bladder training. This is the two main places you see it. It's done other places, but that's the two main ones that most people see. So diuretics. Diuretics increase the amount of urine, and it's done again to maintain your body's homeostasis. There's thiazides, loop diuretics, potassium-sparing diuretics, carbonic anhydrase inhibitors, and osmotic diuretics. There's a lot of different kinds. Uricosuric agents are used to increase the excretion of uric acid. This has helped to prevent the reoccurrence of kidney stones and to treat gout. Gout is that accumulation of uric acid in a joint, usually in the big toe. So we're trying to get rid of that excess uric acid. And then there's different medications that can treat incontinence, like anticholinergics, which can calm an overactive bladder. Antidepressants can treat stress incontinence, that coughing, laughing, sneezing, running, that causes urine to leak from the bladder. So the body's metabolism is continuously producing waste products, and these waste products need to be removed. The urinary system is one of those sources that will remove these waste products. The kidneys contain nephrons. These nephrons help to eliminate these waste products. If we're unable to remove these waste products, it's going to result in different kidney disorders or disorders of the kidneys and ureters. That bladder is a temporary storage place before that urine is excreted out of the body. The two main disorders of that bladder and urethra are urinary tract infections and urinary incontinence. There's a lot of different ways to diagnostic procedures that we can do, and there's a lot of different treatments out there for the bladder, the urethra, ureters, and the kidneys. That is everything on the urinary system. Thank you very much for listening and have a wonderful day.